Welcome to SpectraCell's 2018 Thursday night webinar program. Tonight we have a very special presentation for you, Nutritional Ketosis, presented by Dr. Jose Colon. This webinar is being recorded and you will receive an email once the on-demand version is available. Slides and educational materials are available for download in the Learn More box on the left of your screen, and you may submit questions in the Q&A box. If time permits, we will answer these at the end of the presentation. At this time, I would like to welcome back Dr. Colon.
Hi, hope everyone is doing very well tonight. I'm Dr. Jose Colon, and it's a pleasure to be here to talk about a really hot topic in nutritional ketosis. So again, Dr. Colon, and I'm dual board certified in sleep medicine as well as neurology with special qualifications in child neurology. As a child neurologist, I've had a lot of experience with ketogenic diet, and I've seen some impressive results. I'm also a member of the Institute for Functional Medicine, as well as the American College of Lifestyle Medicine and the Society of Behavioral Sleep Medicine. All of these experiences help make this topic today. So let's go to work. Objectives today is that we're going to review the basics of ketosis. We're going to identify some common pitfalls that we can see sometimes. We're going to discuss the history of ketosis. It's always good to know the background. And we're going to do a literature review of medical use of nutritional ketosis. So the ketogenic diet, you've heard about this already. All the papers are writing about it, and the interest online has just been really exponential. But what is the ketogenic diet, and how is it done? What does keto even mean? So let's talk very basic first. Basically, the body can run off of two main fuels: glucose from carbohydrates, which is what most people have when they're having their bread, pasta, potatoes, and rice. And then also the other fuel is fat. Eggs, meat, avocado, butter, olive oil, nuts, all of these are the fats that we can take in. So the keto diet is a very low carbohydrate diet. So low in carbs that the body has to switch to mainly using fat for fuel. Once again, as we mentioned, eggs, meat, avocado, butter, olive oil. Even the brain can be fueled by fat. Now let's get a little bit more in depth into the biochemistry and the keto science. In recognizing the science, first recognize that your body most commonly uses glucose. It has glucose on hand. When it has glucose on hand, it's going to use that first for energy. In the keto diet, the amount of carbohydrates you consume goes down. Therefore, the amount of glucose comes down too. In order to combat this, your body stores glucose in the form of glycogen, but that's going to eventually run out as well. So your body goes to convert a substance known as oxaloacetate in the liver into glucose. At the same time that this is happening, your body's breaking down your fat into free fatty acids, and then it's sending them to your liver to metabolize another substance known as acetyl-CoA. Acetyl-CoA is then put into the Krebs cycle in the liver cells to produce energy. However, it can't do that immediately. If you remember, there's some oxaloacetate that was being broken down to glucose. And oxaloacetate is also needed by the Krebs cycle to function. Now your liver has acetyl-CoA lying around. So it decides to break it down into substances called acetoacetate and 3-hydroxybutyrate. These are known as ketone bodies. So they generate ketones, hence the term ketogenic. It then sends them to the bloodstream where other cells pick them up and convert them into ketone bodies. And then other cells pick them up and converts the ketone bodies back into acetyl-CoA, back into the Krebs cycle, and energy is produced. So this is really good. This is really good for your brain, as even though your brain utilizes glucose first, it can function onto ketone bodies as well. In fact, ketone bodies produce more energy per gram for the brain versus glucose, providing fuel for your mental capacity. For some, the keto diet can be food restricted. A conventional diet has you eating 20% fat, 30% protein, and 50% carbs. The keto diet, you're eliminating the grains, breads, pastas, and rice, and you're also decreasing fruit intake. The ketogenic diet doesn't fit into the traditional food pyramid, as it shifts you to 70% fat, anywhere from 20 to 25% protein, and about 5% carbs, or below 30 grams. However, there's a range, and the range can be anywhere from 20 to 50 grams. For some, this is a challenge. However, when you look at studies in the Annals of Internal Medicine, it shows that a low-carbohydrate diet has better retention than low-fat diet. And that's some of the conclusions that they had was, compared with a low-fat diet, a low-carbohydrate diet had better participant retention and greater weight loss. During active weight loss, also serum triglyceride levels decreased more, and high-density lipoprotein cholesterol levels increased more with the low-carbohydrate diet than with the low-fat diet. Now, there's other types of ketogenic diets. That's the traditional ketogenic, but there's also very low-carbohydrate diets such as the Atkins. There's modified ketogenic diet that Charlie Foundation has great information on. And then there's also calorie restriction with very low-carbohydrate diets. And then there's intermittent fastings. And intermittent fasting really is a different topic for another day. On top of that, there's also use of MCT oil. But for the purposes of this, we're going to refer to nutritional ketosis as a diet that is generating ketone bodies. Now, some pitfalls that we commonly run into. Number one is root cause analysis. Many people will self-administer a ketogenic diet without conducting a root cause analysis. And when we talk about integrative medicine and functional medicine, we have to understand that there's underlying roots for certain disorders that we may have, that we may want to run the diet for. In some disorders, there's a lack of human studies. There's a lot of animal studies in the ketogenic diet. Animal studies are very valuable. Ideally, you want to confirm these findings in human research. And then some are not aware of hidden sources of carbohydrates. So the other day I was talking to a friend of mine, and they said that they were having problems getting into ketosis, and they were eating chicken that was breaded. That's not making light of the situation, but a lot of people don't realize that there are hidden sources of carbohydrates. Also, there's all kinds of sugars and starches mixed in and added into different food products as well. A lot of the dressings that you may see are sugar-laden. And then some people have excessive protein intake. There's controversy as to how much protein contributes to gluconeogenesis. However, there is no controversy that protein has 4 calories per gram and can also be used as fuel. So high protein intake impairs ketosis. I would like to point out this recent study. that showed that both high and low percentage of carbohydrate diets were associated with increased mortality. However, they defined low carbohydrate as less than 40%. This is not nutritional ketosis. So this is a bad headline. Also, they included high protein diets, which is not going to get you into ketosis either. So this addressed the last two subjects that we just discussed there. Another pitfall is measuring ketones. Some people say that they're doing a ketogenic diet, but they've never measured ketones, so they don't know if they're getting into ketosis or not. They don't know if they're consuming excessive protein or hidden sources of carbohydrates. There's a couple ways to measure ketone bodies. Urine measures urinary excretion of acetoacetate, and this is the easiest, and it's the most common test. However, it may provide some false negatives in results of keto adaptation. There's also blood, a finger stick measuring beta-hydroxybutyrate levels. This is the most accurate. And then there's a breath test as well that measures breath acetone. Having said that, it's important to measure ketone bodies, but having said that, when you're looking at the degree of ketosis, I have not come across a study, and I'm not aware of any studies that show that large ketosis is superior to that of moderate or small. And if someone does have a study that can tell us that, please feel free to email it to me. For the purposes of administering ketogenic diet, when I talk with patients, I just say some degree of ketosis, as long as we are measuring some ketosis. So foods that you can eat on a ketogenic diet, you do eat meats, beef, pork, lamb, poultry, eggs, and fish. And again, not too much protein. Leafy greens. One big misconception of the ketogenic diet is that it's all meat and fat intake, but really a lot of people are focusing more on the phytonutrients that we all love, mostly from above the ground plants. So broccoli, cauliflower as well. High-fat dairy, nuts and seeds, and some nuts and seeds have higher fat content and lower glycemic indexes than other. Macadamia nuts, pecans, almonds, walnuts, sunflower seeds have higher fat content and lower glycemic index than, let's say, cashews per se. And then other fats, coconut oil, high-fat salad dressing, but be careful with the salad dressings because, again, they can be hidden sources of sugar. Avocados and berries. Raspberry and blackberries are very low glycemic, and people should know that in the color spectrum, people in the U.S. have a tendency to take in less of the black and blue and purple berries. So some blackberries are wonderful there. And then if you're going to use sweeteners, you have stevia, monk fruit, and other low-carb sweeteners that you may use. Foods not to eat. Grains, of course, sugar, and then a lot of fruits, especially high glycemic fruits, we avoid, and then tubers or under the ground, below the ground vegetables. Having said that, I do like beet stems. I know that beets have a lot of good properties to them, and the beet stems put into stews or soup can give you some of the similar benefits there without the carbohydrates there. So let's talk history of the ketogenic diet. Physicians of ancient Greece treated diseases, including epilepsy, by altering their patient's diet. An early treatise in Hippocratic Corpus on the sacred disease covers the disease. This dates back to 400 BC, and it argued against the prevailing view that epilepsy was a supernatural origin and that there was cure, and proposed that dietary therapy had a rational and physical basis. In the same collection, in Epidemics, described the case of a man whose epilepsy is cured as quickly as it had appeared through complete abstinence of food and drink. In the Bible, Mark relates a story of Jesus curing an epileptic boy. When his disciples asked him privately why they had not been able to cure the boy, Jesus said, "This kind can come out by nothing but prayer and fasting." And then around 130 AD, Galen believed in an attenuating diet might afford a cure in mild cases of epilepsy and be helpful in others. The first modern study of fasting as treatment for epilepsy was in France in 1911. Patients were detoxified by consuming a low-calorie vegetarian diet combined with periods of fasting. The diet improved the patient's mental capacity. And at the same time, Dr. Hugh Conklin, an osteopathic physician, began to treat his patients with epilepsy by recommending fasting. Conklin's fasting therapy was adopted by neurologists in mainstream practice in 1916. Dr. McMurray wrote to the New York Medical Journal claiming to have successfully treated epilepsy patients with a fast, followed by a starch and sugar-free diet. Diabetes mellitus has long been associated as a disease of carbohydrate metabolism, and before the discovery of insulin in 1921, low-carbohydrate diets were the treatment. Now, you might say there's a lot of epilepsy history. How come there wasn't so much history for the ketogenic diet with other prior diseases? That's because historically they didn't have the amount of chronic disease that we do now. If you saw The Greatest Showman movie, the world's heaviest guy was an oddity in the 1800s. Nowadays, however, a recent study shows that 40% of U.S. adults are obese, 72% of adults are overweight or obese, 52% of adults have prediabetes or diabetes. And let's not forget, type 2 diabetes used to be called adult onset diabetes, and now there's an epidemic in pediatrics as well. Don't blame the butter for what the bread did. When taking a look at principles of human carbohydrate intolerance, this stems from more than 2 million years of evolution when humans had limited exposure to sugar and starches. Now that carbohydrate-based foods are ubiquitous, most of us show signs of metabolic dysfunction. For some, a modest decrease in carbohydrate suffices to prevent illness, but in many, metabolic correction requires greater carbohydrate restriction that results in keto adaptation. Historically, mild ketosis was the normal state before the agricultural revolution. We have a strong evolutionary adaptation to ketones. The brain and many other tissues prefer ketones as fuel as well. Ability as humans to migrate into barren regions depended upon our ability to survive prolonged fasting. This is now a latent human ability put to sleep by modern carbohydrate-centric diets. And this has significant effects on metabolism and performance applications. So, applications of nutritional ketosis. Let's go over some. Well, weight loss is one. One thing that I'd like to note, though, is that please realize that there are several micronutrient deficiencies that may contribute to weight management. So you've established that there's mechanisms of obesity and you're ready to move on to a ketogenic diet. Well, a meta-analysis consistently shows benefits of ketogenic diets on weight loss. And then here's a feeding study. Studies that are more controlled include food. So there's a lot of studies that are out there that use nutrition journals or food recall. When you're using a feeding study, that is more controlled. And in this study, this was done out in Israel. They gave 322 obese adults. They studied them for 2 years. they fed them lunch directly. They fed them food. In Israel, the main food is the main meal of the day is lunch. So all of the food was produced for lunch, and then they were given instructions on what to do at home with either a low-calorie diet that was calorie restricted and is consistent with that of the American Heart Association. They also gave them a Mediterranean diet, of which in this Mediterranean diet they tried to promote more poultry and fish than actually red meat, and then they gave a low carbohydrate diet that was not calorie restricted. And when they talked about fats and proteins, they encouraged more plant-based types of foods. The completion rates were approaching 90%. And the low carbohydrate diet actually used the instruction manual for the Atkins, where they started out at 20 grams per day of carbohydrates and then let them gradually increase. Now, when you look at this, the low carbohydrate diet there in the blue initially started out with a lot of weight loss, starting out like gangbusters there, and they started out at 20 grams per day of carbohydrates. Now, in the end, they allowed them to increase in both the low carbohydrate diet as well as the Mediterranean diet had the overall best long-term weight loss there, as compared to the low-fat group. So the low-fat group, all of them did have sustained weight loss, but the low carbohydrate and the Mediterranean diet fared better than the low-fat group. Now, very interesting, when you look at the low-fat group, they had the highest total cholesterol, LDL, and triglycerides as well. The very low carbohydrate group had the lowest CRP score, so less inflammation. And the low-fat group had the highest fasting glucose as well as the highest fasting insulin levels. Interesting there. So let's talk diabetes. And one thing that's important to know is that when you have diabetes, that there could be some micronutrient deficiencies that are always worthwhile to test for before starting any type of treatment plan, including a ketogenic diet. But nutritional ketosis has been shown to help reverse type 2 diabetes. So in this clinical trial, they had an N of 378 people, and the 262 that had type 2 diabetes and 116 with pre-diabetes. Mean characteristics, they all started at 54 years of age. On a mean basis, the BMI was about 41 kilos, and they weighed about 257 pounds. There were more females than males in the studies, about 67% females. There was a good average reduction in hemoglobin A1C. 94% eliminated or reduced their insulin use. 60% had reduced hemoglobin A1C less than 6.5. 12% had average weight loss, and 83% completed the protocol there. So that's a pretty high retention rate. Let's also take a look at disorders that are affected by insulin resistance per se. Polycystic ovarian syndrome is the most common endocrine disorder affecting women of reproductive age and is associated with obesity, high insulin levels, as well as insulin resistance. So this was a study of 11 women where a very low carbohydrate diet was given, less than 20 grams. And in this low carbohydrate ketogenic diet, it led to significant improvement in weight, percent free testosterone, LH, FSH ratios, as well as fasting insulin in women with obesity and PCOS over a 24-week period. 2 actually became pregnant when they were previously infertile. Clinically, I've had several patients as well that have had PCOS, and they said that they were able to, through nutritional ketosis, that they were able to get pregnant there. What about acne? Acne is worsened by high glycemic foods. It's worsened by insulin. It's worsened by androgen bioavailability, as well as by IGF-1. Well, when you take a look at keto effects on acne and insulin-regulated and influenced pathways, you get decreased proliferation of basal keratinocytes within the sebaceous ducts. You have normalization of follicular epithelium and balanced androgen-mediated sebum. Decreased inflammatory pathways in the skin as well. Now let's talk about dyslipidemia. Okay, we always say that politics is a controversial subject. Well, nutrition is a controversial subject as well to many, and there's a lot of debates in the consumptions of fat. We've all heard all of our life about cholesterol, and many people and doctors steer against ketogenic diet because of cholesterol concerns. Again, I remember my mentors in child neurology would always say, you have to check the cholesterol. We can do ketogenic, but we have to be careful. We have to check the cholesterol. I've had several years of treating kids on ketogenic diet, and it always baffled me onto how their profiles actually improve. And I've never had a patient that's had worsening of a profile. We still have to monitor these things, but let's talk into the science about this. Once again, I do want to also say that there's other reasons for dyslipidemia, that we can have micronutrient deficiencies or imbalances that can do this. I also want to make a specific note and be clear. I'm not telling people to go on ketogenic diet to fix their dyslipidemia, especially if they have end-stage cardiac disease or the best available evidence for end-stage heart disease has been not just with low-fat diets, but with lifestyle interventions such as smoking cessation, exercise, and stress reduction. This is something that we got to follow a little bit more within the literature. But let's take a look at the current state of the literature that we do have. What are cardiologists saying about ketogenic diet? Well, there's a set of cardiologists that say long-term effects of ketogenic diet in obese patients is okay. They found that the ketogenic diet decreased the levels of triglycerides, LDL cholesterol, and blood glucose, and it increased the level of HDL cholesterol. Further, it significantly reduced the body weight and the body mass index of the patients as well. Another cardiologist says the odds of you getting fat from eating fat is about as high as turning green from eating green vegetables. I like that. More information on dyslipidemia. Carbohydrate intake and serum lipids. What exactly is the effect? Well, research suggests that there is an unfavorable effect of increased intake of highly processed carbohydrates on our lipid profiles. And this may have implications for metabolic syndrome, diabetes, and coronary heart disease. Importantly, insulin resistance stimulates HMG-CoA reductase to synthesize cholesterol. That is correct. Insulin resistance is associated with increased cholesterol synthesis and decreased cholesterol absorption in normal glycemic men. So here's a diagram that shows that there. And what exactly do statins do? Well, statins work by blocking HMG-CoA reductase in the cholesterol synthesis. However, importantly, it doesn't address an underlying root cause. One of the mechanisms of dyslipidemia is insulin resistance stimulating HMG-CoA reductase. Let's talk about particle size. This is important. So the larger, more buoyant LDL particles are less harmful than the smaller ones. Small LDL particles reside in circulation longer. They have greater susceptibility to oxidative damage by free radicals, and they more easily penetrate the arterial wall, contributing to atherosclerosis. So, a little bit more about particle size. Dietary carbohydrate restriction increases the prevalence of the larger LDL particles, whereas low-fat, high carbohydrate diets have the opposite harmful effect. When taking a look at LDL particle size again, low carbohydrate diets compared to low-fat diets result in the larger, more buoyant LDL particles and are less harmful than the smaller ones. It can have quite a dramatic positive effect at very low carbohydrate intakes. LDL in general, despite, the study shows that despite being higher in saturated fat, a ketogenic diet decreases circulating levels of saturated fat. Why? Because you're metabolizing it. You're a fat-burning machine when you're on a properly administered ketogenic diet. So this is a recommendation to check the lipid profiles, but not just check total cholesterols, but to take a look at the lipid profiles, and you can do this with SpectraCell as well, with the lipid panels. So another thing that you may want to do is you may want to go into the SpectraCell webinar library and check out some of the webinars that they have there on cardiac testing. So I mentioned that I'm a sleep specialist, and one of the interests that I have is, having the background of both neurology and sleep, is that of narcolepsy, and I do get a lot of patients come to me for this. Now, narcolepsy is a disorder of sleepiness, but specifically it's a disorder where there's less orexin neurons. Orexin neurons are wake promoting, and they also regulate REM sleep. So you end up with sleepiness and REM dysregulation, such as cataplexy, sleep paralysis, and hallucinations when you have the decreased orexins neurons that you see in narcolepsy. One thing that I'd like to point out, though, is yes, we have disorders of sleepiness, but there also are other nutritional causes for fatigue and sleepiness as well, including imbalances in our micronutrient profiles, or some deficiencies in particular can be seen. So let's take a look at non-pharmacological approaches to hypersomnias. Wait a minute, don't you treat hypersomnias with medications? Why would we look at non-pharmacological approaches? Well, medications alone may not completely resolve excessive daytime sleepiness. In fact, less than 15% of patients with narcolepsy rely on medications alone. So this was a study and a review through the Society of Behavioral Sleep Medicine there, that they gave some great information. Common behavioral approaches that are used by patients to manage excessive daytime sleepiness, they do include naps, they do include sleep hygiene, but dietary manipulations as well. Now, further in this study, it talked about how few of these dietary manipulations were actually prescribed by the physicians, and these are things that patients are learning to kind of do on their own. So in this review and survey, they talked about how patients, their conclusions, were that patients with narcolepsy need more behavioral sleep medicine services. And I completely agree with this. But the world of sleep in general completely kind of dismissed the nutrition aspect. They didn't follow that up, suggesting that more intervention needed to be done there. Once again, narcolepsy is a disorder of low hypocretin orexin neurons. Well, what about glycemic effects on these neurons, on orexin? The world of endocrinology has been studying this, and they found that high glycemic index suppresses orexin and low glycemic effects activate orexin neurons. Orexin A is stimulated by low glucose and inhibited by high glucose. And then within the hypothalamic area, it's known to contain neurons that are stimulated by falls in glucose levels, but inhibited by feeding-related signals within the viscera. Orexin neurons may correspond to this neuronal population. What is all this saying? Well, what it's saying is these orexin neurons that are wake-promoting, when you're in a high glycemic setting, you turn them off. So let's study this. Low carbohydrate diet and ketogenic effects have been found to be effective in improving symptoms of narcolepsy. This was a study, a low-carb diet, less than 20 grams per day, Atkins protocol. It was given to 9 patients in clinic that had continuous daytime sleepiness despite all interventions. The sleepiness was measured at baseline within weeks 2, 4, and 8 using 3 different validated self-administered scales. What did they find? There's an 18% reduction in the narcolepsy symptom status questionnaire, 22% reduction in the sleepiness subscale, 13% reduction in the sleep-attached subscale, and 24% reduction in sleep paralysis. That's effective treatment. Now let's talk about sleep in general. And sleep is obviously something that I do. And what stimulated me to open up Paradise Sleep, an educational forum that provides free sleep education. Now, before talking about sleep, I'd like to say that along the signs of sleep, that there are some micronutrient deficiencies that can cause some disruptions in sleep. I've seen it in zinc, which actually can affect ADHD, so can magnesium, as well as I've seen B vitamin deficiencies and oleic acid deficiencies cause insomnia. But a lot of people aren't aware of this, but there's also a lot of micronutrient imbalances and deficiencies that can contribute to sleep apnea as well. Vitamin D is one that I've seen which can increase upper airway inflammation, tonsillar hypertrophy, and I have had a patient with multiple sclerosis that I tested for sleep apnea that was positive, and because he had MS, I got vitamin D levels as well. They were really low, and I treated him pretty good and aggressively, and something happened with his insurance, that the insurance lapsed and they required another sleep study, but when I repeated the sleep study, he didn't qualify again for the sleep apnea diagnosis. Only thing that we did was really beef up his vitamin D levels over a period of time. So that's interesting. Well, in taking a look at some of the literature, this isn't a ketogenic diet literature, but it does say that protein intake of at least 20% of calories produce the best global sleep scales. Well, the ketogenic diet has anywhere from 20 to 25% of protein. Also, oleic acid seems to be especially important for sleep disorders, maybe due to their function as precursors of sleep-inducing oleamide. Well, taking a look at the ketogenic diet and sleep, to date, I haven't seen any literature where they've given ketogenic diet for sleep. However, in patients that have been getting ketogenic diets for other reasons, such as drug-resistant epilepsy, it's been shown to improve sleep quality. Also in patients with cancer, it's been shown to improve emotional functioning as well as have less insomnia. And then also, It's been shown to increase the percentage of slow wave sleep as well. So these are important findings there. What about inflammation? So inflammation is important, and once again, recognize that there are micronutrient deficiencies and imbalances that could be leading to inflammation. But ketosis has been shown to reduce oxidative stress and suppression. Mouse studies and cellular in vitro studies report that the ketone body beta-hydroxybutyrate suppresses oxidative stress, and in this particular study, ketosis was achieved through fasting. This is another animal study, a mouse study, that suggests the anti-inflammatory effects of caloric restrictions in ketogenic diets may be mechanistically linked to beta-hydroxybutyrate-mediated inhibitions of inflammasomes. Now, in the Journal of Child Neurology, one of my journals, review of both clinical and basic research exploring the impact of ketogenic diet on thermal pain, inflammation, and neuropathic pain had some positive results. Compared to glucose metabolism, ketone metabolism produces fewer reactive oxygen species, which are known to contribute to inflammation. Ketosis metabolism produces fewer free radical and reactive oxygen species through affecting the mitochondria. Exogenously applied ketones reduced reactive oxygen species, and positive effects of a ketogenic diet itself on inflammatory processes were noted. Speaking of pain, so they found less pain in that study. Remember that there could be micronutrient deficiencies and imbalances that can be affecting pain. And headaches can be a pain, right? Once again, there are different deficiencies and imbalances that can affect migraines. Now, I don't believe that everyone is going to uniformly benefit from a ketogenic diet for headache. Why? Because there's so many diverse causes of headaches. So once again, one thing that I want to comment is when your MRI is normal and your sleep studies are normal for a headache patient, yeah, I do advise getting a micronutrient profile, as there are several imbalances that can contribute to it. But taking a look at ketogenic diet and headache, there was a study that showed the ketogenic diet group showed reduction in baseline attack frequency, number of days with headache, as well as tablet intake, medication intake. They postulate that the underlying mechanisms of ketogenic diet efficacy could be related to its ability to enhance mitochondrial energy, metabolism, and also to counteract neural inflammation, something that we had just discussed. Here's a case report of two sisters, weight of 78 and 73 kilos. They were prescribed a low carbohydrate regimen with controlled protein, and they had baseline headaches of about 5 to 6 attacks per month. They did a low carbohydrate diet, and they cycled every 4 weeks with low-calorie, non-ketogenic diet. And the end weights, they lost weight, and also their migraines disappeared within 3 days of the ketogenic diet cycle, but reappeared when they were not on the ketogenic diet cycle. So, I mean, that's a case study there. People may not publish case studies when they come out negative. They don't, but it's some information that warrants further looking into there. Depression is the defining illness in our modern society. More lives are going to be lost to cancer and heart disease, but neuropsychiatric disorders are the leading cause of disability. Let's remember that there are several micronutrient imbalances and deficiencies that can affect depression. But let's take a look at ketogenic diet effects as well. So it's postulated that a ketogenic diet may be useful in the treatment of depression. This is actually a rat study, and we have to be careful with the kind of information that we conclude from animal studies, but they still laid the foundation for further studies. The subjects in the ketogenic diet group spent less time immobile than did the subjects of the control diet group. This suggests that the ketogenic diet has similar antidepressant properties. What do we know in humans? Well, what we do know, however, is that a high glycemic load diet is associated with higher depression symptoms, total mood disturbance, and fatigue compared to a low glycemic diet load, especially in overweight, obese individuals. What else do we know? Well, there's a PubMed search, a meta-analysis, and actually a PubMed search of all English language articles published between 1966 and September 2006. The search terms were neurobiology, cognition, neuroprotection, inflammation, oxidative stress, glucocorticoids, metabolic syndrome, diabetes, insulin, anti-diabetic agents, and these were all cross-referenced with DSM-defined disorders. And what they found is an association. And they note that the central nervous system, like the pancreas, is a critical modulator of the metabolism and is engaged by chronic abnormalities in the metabolic process. They propose the notion that metabolic syndrome type 2 is as a neuropsychiatric syndrome. There's also some information here suggesting that there may be some anti-anxiety effects. Dr. Dominic D'Agostino is a scientist that researches the ketogenic diet. He's at my alma mater at the University of South Florida, as well as also works with Moffitt Cancer Center. And this is another animal study, a rat study, that did find that exogenous ketone supplementation induced anxiolytic influence. Now, when they've done more analysis of the literature, the role of ketogenic diet in mental disorders is unclear. Half of the published studies are based on animal models of mental disorders with limited generalizability. In the human studies, there's some major limitations, including lack of measuring ketone levels in some studies, and the issue of compliance is what they found to be an issue in some of their studies. Currently, there is insufficient evidence for the use of ketogenic diet in mental disorders. That's the opinion that was expressed in here. And it's currently actually not recommended as a treatment option. And, you know, I have to agree with their conclusions that there's limited information. But I think that it does warrant a consideration, as opposed to being on the standard American diet, that the ketogenic diet can be tried. Sports. So what about sports in the ketogenic diet? We're not going to go over every single study. I mean, there's a whole book written on this, on the art and science of low carbohydrate performance. But the old concept of carving up appears to be fallacy, maybe, or not for everybody. Let's always remember that there can be micronutrient imbalances and deficiencies that can affect sports. Glutamine deficiencies is one that we see often in these athletes as they burn up that glutamine. Well, guess what else needs glutamine? Your gut. Your gut needs glutamine for tight junctions and just overall gut health. And that's why some extreme athletes may have more GI disorders, so that's a consideration. But ketogenic diet, the information that we do know in sports is that keto adaptation actually enhances endurance performance and body compositions in athletes. Keto adaptation, as we mentioned, improves endurance capacity and improves fat metabolism and oxidation during exercise performance. Liver and muscle glycogen deposits are maintained. attenuating glycogen depletion observed in athletes consuming high carbohydrate diets is actually seen. Keto adaptation improved aerobic and anaerobic exercise capacity as well as body composition of endurance athletes. Now, there are a couple of teams in rugby or soccer that have adapted ketogenic diets. I think that this is something to keep an eye on a little bit more. As I mentioned, there's a whole book on that. Autism. We know that there's been an increase in incidence of autism. Also, the number of publications in autism has skyrocketed. Now, I don't want to suggest that you can cure autism with finding an isolated micronutrient deficiency, but you can really improve quality of life, and you can really improve symptoms as well with both autism and ADHD by finding micronutrient imbalances. But let's talk about the ketogenic diet in autism. There was an open-label clinical trial of a modified ketogenic diet, gluten-free diet as well, with supplemental MCT oil. Children anywhere from 2 to 17 years of age. Interventions, they did ADOS testing as well as some other testing on them, and they compared them at baseline 3 months, 15 months as well. And the results showed that in the ADOS, 19% mean improvement in social effect score, 20% improvement in overall total score. But also, really importantly, the parents report included improved eye contact, meaningful language, interest in others, and also improvement on focus and hyperactivity. I mean, these findings are huge to a parent. So there may be a role here, and definitely more studies need to be done. What about cancer? So what do people do to detect cancers and metabolic activity? They do PET scans. Well, what do PET scans do? They identify areas of higher glucose metabolism. On a PET scan, overactivity, consumption of glucose, is typical for cancer compared to normal structures. What does that tell you? Cancer cells love sugar. So one consideration that you may want to do is check out the webinar by Dr. James Roach that talks about integrative protocols for cancer. And the ketogenic diet has several potential anti-cancer mechanisms. Glucose dependence on cancer cells. The ketogenic diets increase cancer cell oxidative stress, and mitochondrial metabolism in cancer is affected as well. Ketogenic diets decrease the capability of tumor cells to produce NADPH. Thus, ketogenic diets increase oxidative stress in tumor cells relatively to that of normal cells by limiting NADPH regeneration. So here's a case study in someone with GBM that they received the standard of care there, the steroids, anti-epileptics, resection, okay, and chemo, okay. But they also started them on a ketogenic diet, and you see the MRIs before and after. And the brain MRI taken a few days after ending the protocol, along with concomitant ketogenic diet. There's no clear evidence of tumor tissue or associated edema was seen. Do larger studies need to be done? Yes. But in the meantime, we have some information that ketogenic diet may be safely used as adjuvant therapy to conventional radiation and chemotherapies. And I want to note, I'm not saying in place of, okay, adjuvant therapy. Ketogenic diet is sustainable even for advanced cancer patients and has no severe side effects and might improve aspects of quality of life and blood parameters. Dementia. So we didn't forget to talk about this one, all right? Understand that there are many micronutrient causes for dementia as well, and I think that there's enough information for SpectraCell to make a new wheel about this. Much of the benefit of ketone bodies can be attributed to their ability to increase mitochondrial efficiency and supplement the brain's normal resilience on glucose. Talking about mitochondria, Observations supported by studies on animal models and isolated cells show that ketone bodies, especially beta-hydroxybutyrate, offer neuroprotection against diverse types of cellular injury. Other possibilities could be through actions that are antioxidant as well as anti-inflammatory as well. So they did a study to see how feasible this was and ketogenic diet feasibility, and they had 15 patients enrolled over a 31-month period. 5 participants did not successfully implement it, and they withdrew within the first month, and they unanimously stated caregiver burden. Of those that finished, no serious adverse events occurred. Among the completers, the mean Alzheimer's disease assessment scale, cognitive subscale, improved by 4.1, and all except for one that was non-compliant and reverted to baseline after the washout there. So ketogenic diets can fix dementia? Not so fast. We have good information saying that it helps. And Dr. Bredesen says everyone knows someone who survived cancer, but no one knows anyone who survived Alzheimer's. But his book does offer nutrition as a basis, and also the Institute for Functional Medicine has divides in their Mito food plan, a Mito KetoFlex food plan that is being used in a lot of his work. But it's more than that. Lifestyle changes, exercise, sleep, stress reduction, brain training, resolving inflammation, okay, and inhibiting new inflammation, removal of the inflammatory sources, and healing the gut are all part of the protocols. Common micronutrients not meeting the DRIs on the ketogenic diet can include vitamin D, calcium, zinc, selenium, phosphorus, iron, potassium. So these are all things that we can monitor over time as well. So I just want to mention some key take-home points. Proper application of nutritional ketosis is safe. Start with the standard of care. All right. Nutritional ketosis is effective for several brain-based and metabolic syndrome-related disorders. And then also, before applying ketogenic diet for a disorder, make sure the underlying causes have been evaluated. So, as I said, start with the standard of care, but then go above and beyond and look into other types of root cause analysis, including nutritional imbalances as well. That's the time that we have. I want to thank everyone for joining us. Feel free to contact me directly if you have any questions. And as I always say, remember that when we encourage others to encourage others, we make this world a better place. Thank you.
Thank you, Dr. Colon, for such an informative presentation. We are currently out of time for questions, but as Dr. Colon mentioned earlier, you can reach out directly to him. And I wish you a wonderful evening.